Good afternoon. Today we will see about the complications which are faced with the prolonged bedridden patients, and also what we can do our exercise therapy as a management for the prolonged bedridden patient. Okay. So any idea about prolonged bedridden patient? So who are all considered the prolonged bedridden patient? Any? That means which conditions are considered the prolonged bedridden patients? So mostly neurological patients. So mostly neurological patients will come under the prolonged bedridden patients. In the neurological conditions, so especially head injury or spinal cord injury. Yes or no? So if head injury or spinal cord injury, so in head injury the patient will be involvement of conscious, but in spinal cord injury there won't be any involvement in the conscious level, but there will be involvement in the both lower limbs or both upper limb and both lower limbs, depends upon the area which is got affected, or depending upon the level of spinal cord which is got injured or which is got involved. Okay, so in that kind of patients, so what are all the complications will the patient will faces? So initially due to the prolonged pressure applied from the patient on the bed, it leads to the bed sores or the pressure sores. It leads to the bed sores or the pressure sores. So what are the common areas which may get involved in these bed sores or pressure sores? So especially gluteal region. In the gluteal region, either there may be central region like sacral area, or there may be any gluteal maximal lateral area also may involve. Okay. So apart from the gluteal region, even calcaneal area will also involve, and also polygonal area or posterior elbow area will also may involve. Okay. So the bed sore or pressure sore is the first complication that the prolonged bedridden patient will face. So after that bed sore or pressure sore, any other complication? Muscle atrophy. So before muscle atrophy, due to the bed sore, due to the prolonged bedridden, next complication will be depends on the DVT or deep vein thrombosis. So why DVT or deep vein thrombosis? Because that's a no movement or lack of movement. So followed by there will be a decreased venous return. So due to the decreased venous return, the blood may be stagnant in that particular area itself. That is the calf region. So this may end up in the condition called deep vein thrombosis. This may end up in the condition called deep vein thrombosis. So this deep vein thrombosis is another complication that the prolonged bedridden patient will face. So next complication is, like you said, next complication is the muscle atrophy. So muscle atrophy is nothing, it's a muscle loss or muscle wasting. So when the muscle wasting will occur? When there is no movement, automatically the muscle bulk or muscle power will go for the decreases, or due to the muscle power decreases, the muscle bulkiness will go for the muscle loss. So then automatically there will be a muscle atrophy. Okay. So if muscle atrophy prolongs, then what will happen? The joint will not be in a neutral position. So once the joint is not in a neutral position, there will be the formation of the contractures in the prolonged maintained position. For example, if the wrist should be in a neutral position, there won't be any contracture. But instead of the neutral position, the wrist is going for the flexion position for a prolonged period of time. And automatically the flexion motion will go for the contraction. Then there will be no movement of the wrist extension. Then it will be end up in a deformity called wrist drop. So due to the muscle atrophy, patient will experiences the muscle contraction due to the maintenance of the joint in a prolonged position. Okay. So and these will results in the deformity. So especially it will occur in proximal area or distal area. So especially it will occur in the distal area. Especially it will occur in the distal area. So contracture is one of the complications, as well as muscle atrophy, as well as deformity is also the one of the complications. So apart from this, any other complication? So what about the respiration or thoracic level? Bedridden is a prolonged bedridden. So automatically the thoracic expansion or thoracic movement will become decreased. So it may be decreased due to the sputum collection, or otherwise due to the artificial respiration. Yes or no? Once the patient not moving or not doing any functional activity, automatically the necessity of oxygen will become decreased. Once the oxygen is decreased, then automatically classic expression is also decreased, then it ends up in the breathing difficulties. So it is also one of the complication where the prolonged respiration will face up. Okay, so is it clear? So what are the complications will the prolonged respiration will face? Is it clear or not? So any other points you have to add in this condition or any suggestion? Infections. So due to any external appliances like tracheostomy or urinary catheter, so it may give a way for infection to enter into the patient body. Then it will create some other pathological process. So apart from that infection, any other points or any other suggestions? So blood and bowel, as I said, so by means of blood and bowel, the urinary tract infection also will occur. So for that we have to be conscious on the blood and bowel management also. Okay. Okay. These are all about complications cases related to prolonged patient. Okay. Thank you.